What is lameness? Lameness is a dysfunction of the limbs, creating a perceptible variation in movement or gait. Pathophysiology. It is caused by the following. One, pain alone. 2, instability in the skeleton. 3, mechanical abnormalities. Also, neurologic dysfunction could be one cause. Lameness is classified based on the severity and course of onset. Severity of lameness is based on a grade system. Grade 1, 2, 3, and 4. For grade 1, they are barely perceptible lameness. Example is wound or laceration. Grade 2 are noticeable lameness but weight-bearing. Example is hip dysplasia. Grade 3 are severe lameness with use of limited to touching the paw to the ground for balance. Example, bone neoplasia. Grade 4, not weight-bearing, limb is being carried. Example are fracture and snake bite. For the course of onset, it could be an acute onset, or chronic insidious onset. Acute onset are typical of traumatic diseases and infections like foot lacerations, fracture, and blunt trauma. Chronic insidious onset without an acute initiation is most typical of degenerative problems, especially those involving joint. Examples are hip dysplasia and osteochondrosis. Diagnostic plan of lameness are orthopedic examination, physical signs related to lameness, radiographic examination, special diagnostic aid like fine needle aspiration, and exploratory surgery and biopsy. Symptomatic treatment are to control the pain, unstable limb should be splinted, and intake of non-steroidal prostaglandin inhibitors like aspirin. What is ataxia? Ataxia is incoordination of movements. Without spasticity, paresis, or involuntary movements. Pathophysiology. It is caused by: first, disorders of the conscious or unconscious proprioceptive systems or sensory ataxia. Second, disorders of the cerebellum. Third, disorders of the vestibular system. Sensory ataxia happens when there is a 1. Tumor within the spinal cord, 2. Bleeding within the spinal cord, and 3. Failure of nerve conduction capacity of the spinal cord that will lead to toes are being dragged on the ground and the foot are wide open when standing. Vestibular ataxia happens when the inner ear or the brainstem is damaged or abnormal, which will lead to head tilt. Cerebellar ataxia could happen when there is an inflammation or malformation of the cerebellum and metronidazole toxicity. And this will lead to ghost-stepping gait and head tremor. Diagnostic plan are lesion localization and finding the cause of the disease. There is no symptomatic therapy. What is prognosis? Prognosis is the patient's chance to recover from the disease. For sensory ataxia, there is a better prognosis. Cerebellar disease have poor prognosis, and for peripheral vestibular disease is often good prognosis.